So it's been a week and 2 days since our first visit, and I thought I would have my client tell us how she's doing.
I was just saying I can walk so much more freely, more easily. I feel bouncier, and I'm a lot faster. I haven't had very much pain in this week and a half since I first saw you at all. Except a few days ago I did the quick and easy corrections that you showed me with the foam blocks, and I was able to sleep that night with no pain. So it's been overall really, really amazing change, way more than best case scenario that I could have imagined.
And you're doing some pretty nice strengthening. Tell us what you're doing.
You've got me doing quarter squats with heel raises, pelvic tilts, and then the opposite of a pelvic tilt.
Right.
Putting a foam block on my sacrum and then bending over just a quarter. I think that was to get used to turning from my waist.
Yes, And then you're using a kettlebell.
Yeah, I'm using a kettlebell with the quarter squats and heel raises, and a kettlebell turning left and right from the hips. Twisting.
Yeah.
And was that all?
And that's 28 pounds of kettlebell, right?
Yes.
That's great. And you're walking 8 miles?
Yes, 8
And
miles at least.
Sounds like you're going to be a little more active even as you get to your new, your work site is in the new building will have all kinds of activities, right?
Yeah, we have a spin class, some yoga classes, Pilates, head to toe strengthening, so I'm excited to continue to do those, and I had previously shown you an exercise that I couldn't even do with my joints all locked up the way they were, so now I can do that one also.
Great. Well, it was 3 visits, and today is a short visit because everything is retaining its normal mobility. So I really didn't treat you today. I just taught you a couple of little things. So I'm really pleased with the progress. I think that I should just see you on an as-needed basis. And I think following up with a massage therapist makes real good sense. I think now you'll get more benefit from it now that we've balanced the structure. Mm-hmm. So now the soft tissue, any changes that he can induce with you, I think that's going to be a lot more long-lasting. So, where do you see yourself doing in a year from now?
Continuing to go to the gym, hopefully, and maintaining my health that way. But honestly, my biggest complaint was that I was in constant pain, and I have not been in pain since I saw you a week and a half. So my massage therapist who recommended me to come here, he had told me if it's going to work with Jerry, you'll notice on the first visit. And there was a night and day difference from the first visit that, like I said, was better than best case scenario.
Very good. And you have not had to take any pain meds in the night?
Nope.
Since a week and 2 days ago?
Yeah, and my goal was like once a week, if I could get down to once a week, and I just haven't needed them. Wonderful.
And you said that you were planning a family someday, but that the pain meds was interfering.
Yeah, prescription painkillers and pregnancy do not mix. And obviously you don't want to, get pregnant and give that child a bad start. I had seen another doctor and asked her what I could take while I was pregnant. She recommended muscle relaxers, which I also wasn't comfortable with, but
sure.
If it could, at this point it's not about what's optimal, it's about just getting through it somehow without having like a drug-addicted baby or something terrible like that.
Like me? No, I'm kidding.
Well, I have friends that have been there, but
yeah.
It's not a good thing certainly for anybody. But yeah, even the muscle relaxers I wasn't comfortable with, but I was gonna give them a shot, but I was still waking up in the middle of the night with the muscle relaxers because they didn't touch the pain. And now I'm not taking anything and I'm not waking up in pain.
Sweet, that's wonderful. Well, it was a very interesting thing, and just to recap the things that we found with you was that you complained of hip pain, and on the pain drawing you drew on the front of the left hip, and on the back of the left hip. And what we actually found was at the bottom of the femur, at the knee joint, was stuck backwards, stuck in posterior glide. And so we restored normal glide to the knee, to the distal femur, and then we treated the left pubic bone. It was glided posteriorly and stuck. There was a distinct step off. So it wasn't just how you were laying on the table, it was a shift in the pubic joint itself. And so we corrected that. And then you had the posterior glide of the sacrum. And these are both patterns that I've discovered. They're not in the literature. And the sacrum wedging backwards posteriorly. I call it posterior glide sacral fixation. That essentially blocked all movement through your pelvis. So your SI was essentially stuck. And we restored anterior glide of the sacrum and also posterior glide of the pelvis on both sides. And somehow that in your body equated with left hip pain. And I can certainly see how it could alter muscle function. So you probably had a lot of muscle inhibition. And so it wasn't protecting that hip joint.
Like I said, at the gym, there were some things that were like just really basic things that everybody else had no problem with. And even after going there for a year, like just doing a lunge, I would still want to fall over.
Uh-huh.
And just really basic things were really hard for me, that I feel very different doing those same things now.
Yeah. Well, when I'm filming, I'm showing some of my degrees and certificates, but I should actually show some of my art. I like to collect glass. And there's a research project on the Hesch method, and there's Karen the boss. And there's my 4 boys when they were very young. They're now in their 30s. And I should also capture Lola the puppy. She belongs in this as well, since you're a dog lover. But I'll stop filming here. Any final comments?
Just that I'm so grateful I listened, and I've told everybody about you, because it just really doesn't, it sounds too good to be true, but somehow you've performed a miracle on my hip.
And it took you a while to get to me, because Larry had told you a couple years ago.
Yes.
But what did he fail to tell you? That you would have come sooner.
It wasn't, well, part of the thing was if I knew you had a husky puppy.
Right.
But that's more. But really, it's just after seeing so many different chiropractors, physical therapists, massage therapists, osteopaths, orthopedists, the list goes on and on.
It gets wearisome.
And it's like, what else am I gonna do here? Like I'm already on the treatment plan that every single one of them agreed to, and it's helping. It's just helping really, really slowly. And after a year of really keeping up with it, I had less pain, but I was still in daily pain. And I don't know, I looked at your website and I thought it was probably too good to be true, and couldn't even allow myself to dream about not having this daily pain.
Yeah. So it was a question of belief.
Yeah.
Yeah, and I don't know how to overcome that. I don't know how to advertise. I don't know how to say this is different and might be worth trying. That's a mystery there. I'm a clinician, not a marketing guy.
Yeah, well, you're very, very good at being a clinician.
That's my favorite thing to do, so.
I've told as many people as I could. I've got a coworker that might be giving you a call, but I'm happy to serve as a model.
Oh, and, super. Well, you already have. Yeah, you already have. I appreciate that. But we may take you up on that.
Yeah.
When we do more filming, but we'll even pay you. We don't take advantage of people's kindness.
No, it's not about kindness. It's about I've been suffering for so long, and this actually works. And I want to shout it from the rooftops.
Very good. So it's okay to call it the Hesch method?
Yes.
Good. I get flack from some people. Oh, you're so egotistical because you use your name. I go, okay, so what should I name it? Give me a good name and I'll name it.
It's just so different from anything else, and it's the massage therapist that recommended that I come here. I saw him earlier this week, and we were just talking about how he said you could see how it would be so difficult to show a chiropractor who's so used to these quick, sudden, jerky movements how something so gentle and subtle could have even more lasting effects. And yeah, people think you have to be so aggressive with it, and I would have thought the same thing. But felt like you were doing nothing, and it's a night and day difference.
You know, yes. And there's also this belief out there, well, you've been hurting for a long time, so it'll take a long time to get you better. And in fact, we did use a longer duration of treatment. You know, to glide the sacrum forward, that was 10 minutes. That's a long time to be putting force on one joint compared to the norm out there. Mm-hmm. But the benefit came very quickly. And so we've disproven that belief that it'll take you a long time to get better. This was, I don't think today's visit counts even. I mean, it was just a little bit of fine-tuning. But in 2 visits, we took you off of your pain medication.
It was really one visit.
Okay.
And because the second visit, you just showed me how to keep it up. You wanted to see how it kept up without me doing anything. But if I had known those things, you know, it was really the first visit correction that was all I needed. It was amazing.
So the second visit gave you something. It gave you the ability to self-treat.
Yeah, but
So you're doing a preventive program now.
But I'm saying that the one visit was all it took for you to fix me.
Yes,
and
yeah.
then I just have to keep up with it. But it's not even. I had really intense physical therapy to do. It was very time consuming. It was difficult. And I just didn't get around to doing it that often because of that. And your methods are relaxing and they're nice. And the other thing is I know it works, so I'm much more inclined to want to do it.
Exactly. Yep. People will do what works. So any final thoughts? I've yammered on long enough, I think.
I had something and I don't remember what it was.
Okay.
I'm just really, really grateful.
Well, thank you. And thanks for letting us film. I appreciate the ability to share this work.